Okay, Dr. Chris here at the Nerve Health Institute. This is one of our screening devices that we use. It's called a DePuls, and it actually uses heart rate variability to look at the healing side of the nervous system, which is called parasympathetic. So you can see you have two sides of your nervous system. One is called sympathetic, which is surviving, worried, fearful, anxious. We all need that side, right? If somebody pulls out in front of you, you have to stop, right? That's that sympathetic side. If you're worried about something, if you got to go, react to something, that's that sympathetic side. But the parasympathetic is healing, calming, relaxing, digestive, sleeping. And oftentimes people come to us and this anxious side is really working. It's like a bodybuilder. But this side over here is just can't even pick a 5-pound dumbbell up. It's very weak. So we have to work at strengthening this side up. That's part of what we do here at the Nerve Health Institute. But we also have tests to kind of go through this. It's the pulse test. It measures this parasympathetic side of your nervous system using heart rate variability. And it's just looking to see what's good or bad. So Cameron will sit here on this scan in a closed room, very private, totally relaxed, and we want the patient just completely relaxed for this test. Within 8 minutes, it'll pull up a very detailed scan that we can print out. It's on a computer, and it shows us all these different markers. So you can see this particular patient had a stress index. It should be between 10 and 100. This one is 602. We see this often where the nervous system should be really calm, relaxed. It should be sleeping. It should be healing. And unfortunately, a nervous system like this is so stressed and worried that it's very difficult for it to heal. So we'll start to see some of these numbers get out of where they should be, and it goes through a variety of all kinds of things. You can see it even goes into the biological age versus the chronological age. And obviously, when people come to see us, if that sympathetic side of the nervous system is overworking and the parasympathetic's not, it'll age you. And next thing you know, you go from an age where you're supposed to be 23 and you're more like 31. So this scan also goes into organ function, and you can see a lot of the percentages. We want these percentages to be much higher. The normal range on the test is 66 to 100. We want at least that in our patients coming to see us. So it's a wonderful test to actually go through and look at how well the nervous system is balanced, and then also how well the heart rate variability is in the body in terms of the overall function of everything. So wonderful scan. We do this on the initial visit as part of our findings to be able to figure out what's going on with you and then how we can actually fix the different problems that you have.